Hi, my name is Marissa. I am a nurse and instructor for a medical assisting program. In my program, I also teach phlebotomy and EKG as well. My students certify through NHA, which is National Health Career Association. So I am going to talk a little bit about how to prepare for a certification exam. I'm going to start with the test plan. I'm going to focus on the medical assisting exam, but NHA offers a test plan for all of their certification exams, so you would just need to look up the test plan for whatever exam you're going to take. So the test plan really kind of gives you a blueprint of what will be on the exam. So you'll know how many questions come from each section or what percent come from each section. So for the medical assisting exam, the first section is foundational knowledge and basic science. So that's things like scope of practice, which is very important for a healthcare professional to understand their own scope of practice, as well as even some other healthcare professionals, their scope of practice. Understanding the different roles of healthcare professionals falls in this, and medical terminology, which I'll talk more about in a minute. Anatomy and physiology is the next section. Surprisingly, there are not very many questions from that category. However, having a solid foundation in anatomy and physiology is crucial, I think, for any healthcare career path. The next section is clinical patient care. This is the big one because over half of the questions on the exam come from this section. So that's things like vital signs, EKG, phlebotomy, injections, all of your sort of hands-on clinical skills, suture removal, staple remover, all of those things. The next section is administrative assisting, so that's things like answering the phone, EMRs, scheduling, all the office-related work. All of that is going to be in that administrative section. They do like to ask a lot of questions about formats of business letters, so if you're not familiar with that, you may want to add that to your study routine. The next section is patient communication. My big tip on that one is whatever is best for the patient will be the answer. So they also like to ask questions about patients with hearing loss, vision loss, language barriers, and what you would do for them. So make sure you zone in on those particular areas in that section. Lastly is medical law and ethics, and so that's things like HIPAA, which is important for any healthcare career path that you understand HIPAA. The medical assistant scope of ethics, advanced directives, the different types of consent, you need to know those rules. Understanding all of that will give you a great starting place to start studying for the exam. So the next thing I recommend, and really this is the top thing, make sure you have a solid foundation in medical terminology. This is vital because oftentimes I will see that even if the student doesn't understand what the question is asking, they can figure it out if they can break down the medical terms. And NHA asks their questions using medical terms. So making sure that you have a good foundation in that is really important. There are lots of great ways to study medical terms. You can take a medical terminology college class. You can, there are Quizlets with medical terms. In my class, we use Dean Vaughn medical terminology, and if you're not familiar with that, they use these very silly audionyms to help students remember, and they do seem very silly, but they work. So that's what we use, and I do recommend that. I also have some medical terminology material and games in my Teachers by Teachers MB study spot if you're interested in those. The next thing I recommend when you're studying is active learning. So if you're just going to read through a study guide, if you're just going to read a page over and over, you're not retaining that information. So instead of that, break up that material and make flashcards or make your own practice questions. My favorite thing to recommend is to teach someone else. So once you feel like you got a grasp on a particular section or type of material for this exam, teach someone else, teach your family member, your friend, your classmate, your dog. It doesn't matter. If you can teach someone the material, that means you understand it. So I highly recommend teach someone else. The next thing is making sure that you study correctly. So it's not about studying for a long time. It's studying for the right amount of time. So trying to cram in a study session the day before an exam you will not be successful in that way. You're much more likely to be successful if you study over time and you break it up into increments. Study for 25 minutes, take a 5-minute break. Study for 25 minutes, take a 10-minute break. Study for 25 minutes, take a 15-minute break. That's how I always recommend studying for my students. Again, you can choose however works best for you because everybody does different, but that's my recommendation so that you don't get burnt out. Another really important thing is I always say only study what you don't know, not what you do. We're not going to study things that we know really well over and over. That's not doing anything. So we only want to study the things that we don't know. And how do you know what you don't know? Is you take a practice test. So NHA has really great practice tests that you can purchase. I highly recommend them because it gets you familiar with the testing process, the way they do testing online, the way that their questions are worded. I highly recommend those. But if you can't do those, then there are some great Quizlet choices, practice tests. There are some great practice tests out there. Make sure, though, that you get a practice test that is worded the way NHA words their tests, and that they're multiple choice, and that you get feedback on what you get wrong and why would be nice, which is why those NHA practice tests are great, because it will not only tell you what you got wrong and why, but it'll also put all of those in a category and let you know which category from that test plan you need to focus on. And then the very last thing I recommend is stay calm and stay confident. I teach my students that your brain only knows what you tell it. So if you walk in to that exam, even if you know you've studied the right way, all the material, you understand it, but you have test anxiety, right? So if you go into that exam saying, I have test anxiety, I'm not going to be able to do it, you will very likely be unsuccessful. However, if you know you've studied, you know the material, even with test anxiety, if you tell yourself, I have prepared for this, I know this material, I will pass this exam. Remember, your brain only knows what you tell it. You're much more likely to be successful if you do that. So those are my recommendations when you are taking a certification exam or preparing for one. So you've got this. Stay calm, stay confident, and if you need any resources, let me know.